Hello, I'm Llewellyn King, co-host of ME CFS Alert, and I'm sitting in the heart of Silicon Valley at a place called Mountain View, where I'm talking with Dr. Andreas Kogelnik, who is working very hard to set up a new institute that will primarily, first and foremost, work on chronic fatigue syndrome. But before we get to discussing CFS, you are, in fact, if you were in your ancestral Austria, you would be doctor, wouldn't you?
I would.
Because you have a medical degree and a PhD.
That's right.
And everybody calls you Andy. In fact, doctors aren't very formal anymore. No more white coats.
Patients can call me whatever they'd like.
I was at a big hospital in England recently, and I noticed the only way you could tell the doctors was with stethoscopes. And then I realized, wait a minute, that's not a very good security issue. A stethoscope, you can buy them in drugstores. What drew you to CFS?
Well, I think, when I was at Stanford and I started looking at this disease, it really was an area that was much in need of clinical medicine and clinical physicians interested in practicing in this area and understanding it as it was in research. And my research in particular was aimed at better understanding of diagnostics and identifying treatment targets on a molecular level. So it was another aspect of CFS that was just crying out in need for some good research. So that was a great fit from the start.
What would you say to patients coming to see you nowadays? How much hope can you extend to them?
Well, I think the last year in CFS research has really been a turnaround year in many ways, in that there has been so much more interest and excitement building in terms of looking at some of the mechanisms for the disease, as well as looking at various treatments, that some of which have shown some promise, like rituximab, where there's a lot more work to be done, but now at least there's a lot more people who are vetted scientists who are really committing themselves to working in this area.
Why are there so many difficulties? Difficulties getting other doctors to recognize it, difficulties getting the media to recognize it, difficulties getting the government to recognize it. Are there other diseases that have this kind of struggle?
Well, I think it's not that unusual for chronic diseases and for diseases that are difficult to understand to have that kind of problem. We've seen the same kind of struggle, maybe perhaps not as large a degree, but with MS. Parkinson's disease 10, 20 years ago was not even acknowledged as existing. H. pylori infection as a source of gastric ulcers was laughed off the table for a generation of physicians before two physicians got the Nobel Prize for understanding and documenting that in terms of how it worked, and we treat patients regularly for that now.
You work closely and have actually laboratory space in the local hospital. What hospital is that, and what is your association?
We're right next to El Camino Hospital here in Mountain View, which is a district hospital, so it's a sort of public hospital. We actually, our landlord here in this building is the hospital itself, and they've been very gracious with how they've helped us to set up a research program here, as well as support some of the clinical activities.
Tell me about talent. In all fields, there's a finite amount of talent, of the researchers, the physicians, those who are not going into private practice in the normal sense. How do you attract them to CFS research when there's, well, say, more glamorous things, or things that have a much higher profile publicly? Breast cancer comes to mind.
Yeah. Well, I think it takes a certain type of individual and a certain sort of curiosity for starters. I think one of the advantages that we have being here in Silicon Valley is that we have all kinds of talent and all kinds of interesting ideas and people with interesting ideas floating around. And that gives us a great pool to draw from. When we need somebody who can do a gene expression study or do flow cytometry, we have an expert right up the street, and likely several laboratorians that come with that expert that we can draw on and perhaps draw into the institute
Part
directly.
of your plan is to set up a computer network, a diagnostic and informational network. Does being in Silicon Valley advance that?
Absolutely. We have great relationships and draw on not only for our technical staff in terms of engineers and so forth to help set that up for what we're already doing. We have a great infrastructure here to be able to support that from a technical capacity in terms of fiber networks and computing infrastructure, as well as being able to draw people from the surrounding area and leverage some of the social networking technologies and companies that are here in the valley as well.
What are you doing now about funding, and what are you going to do in the future about funding? Everything you talk about seems to me to be very expensive.
Well, there certainly are costs associated with it. We've been very fortunate that the CDC has come on board with us, and we're working with them closely to start off on a data collection network process for the CDC. We, in cooperation with several other clinics as well, but using our clinical network as one of the mainstays for that. We also look for philanthropic funding, so we're launching a campaign there and have a wonderful staff, and we've done lots of outreach with different patient groups. And we also go after industry-sponsored clinical trials and things like that, as well as NIH and other funds to try to pay for some of the trials. So we kind of spread our efforts around to try to leverage our efforts in any way that we can get resources under them.
We started this little segment by talking about your double degree. Tell us a little more about yourself. What, for example, do you do when you're not working?
Well, like many Bay Area folks, I try to head up to the Lake Tahoe area as much as I can, which coincidentally is one of the places where some of this epidemic was first identified. And certainly love the outdoors and skiing and hiking and so forth.
And I imagine you won't have much time. You have two small children, too.
I do.
What sort of hours are you putting in here at the clinic?
Far too long hours, but my kids definitely get a good share of time as well.
Good luck to you, Andy.
Thanks so much.
It's a pleasure to talk.
If you would like to sponsor MECFS Alert, please contact us at mecfsalert@gmail.com. Help us to help you.